Video I want to start talking about male reproductive anatomy, and I'm going to sort of use our very well shaven model here to talk about it. Right here, this area, which is going to be skin surrounding the testicles, that's the scrotum. And you might find yourself wondering, why have a scrotum? Why is everything sort of out and dangling rather than inside? And it's because that the sperm actually like a lower temperature than the body. And so we actually want the sperm to be in the scrotum, which is outside of the body. And your sort of fun fact of the day, if I can get rid of this skin surrounding our model, is that on these, attached to these spermatic cords or spermatic fascia, there is a muscle. And this muscle is responsible for raising the testicles up when it's cold and lowering them. There we go, there are our muscles. Raising the testicles up when it's cold and lowering the testicles when it's warm. And what they're trying to do is it's trying to keep the testicles at the ideal temperature for sperm. Now, there's some things in anatomy I can't make up, and they're funny because I'm internally 5. The muscle that does this is, and I kid you not, it's called the cremaster. So now you know, and you can impress your friends with that knowledge. And this would be the shaft of the penis. And here, surrounding the head of the penis, or the prepuce, we have the foreskin. Now, depending culturally and geographically where you live, these may or may not be more common because a lot of people choose to remove them at birth. Underneath that foreskin is the head of the penis, and that's where we would have the urethral orifice. Just for the sake of completeness in your education, I have removed the skin here, so now there is no foreskin attached to that penis. So let's sort of remove all the skin now and look at what's going on. And what I want you to see is that there's dense fascia surrounding the testicles and surrounding the scrotum. And what this fascia is doing is it's kind of helping to keep things together and keep them supported. You'll notice that the penis has several layers of tissue. Each of these has a different fascia surrounding it. The upper part has Buck's fascia surrounding it, and then this tunica albuginea, and that's surrounding the upper part of the penis, which is known as the corpus cavernosum. You have 2 sides to that corpus cavernosum, and underneath it there's another part, and this is unilateral, that means that there's only one of them, called the corpus spongiosum. These are the spongy tissues. These are the tissues that engorge with blood during an erection. If we look at the testicle, we can see that that is also surrounded by fascia, and that's just going to keep it supported. When we remove that fascia, if I actually had the blood vessels in here and the nerves, what you would see is that that testicle is surrounded by a lot of nerves, and it and the penis are getting a lot of blood. Well, for the penis, that makes sense because it's going to use that blood to engorge. The testicle also needs that blood to support itself. The nerve endings are kind of important because I always get asked by my male students, inevitably, whoops, I put in lymph instead of nerves because it's that kind of day. There we go. There are the nerves. I always get asked why, when you get kicked in the nuts, do you feel it in the stomach? Well, if we look at where those nerves go onto the spinal cord, they sort of attach to the same nerve root that your abdomen would attach to. So that's why when you get kicked in the balls, it feels like you got kicked in the stomach. The more you know, huh? So when we get rid of all that stuff, let's just take it out. Now we're looking at a testicle. So here is the testicle, and then sitting on top of the testicle is the epididymis. What happens here is that the sperm will be made within that testicle, and then it will go to the epididymis to be stored. When it's time and our man is having a moment, it goes through the vas deferens and ends up getting into the urethra. And we'll talk about that pathway in just a moment. What I want to do is slice this testicle in half. And what you'll see in here is sort of these dense spaghetti looking things. These are called the seminiferous tubules. And this is where the sperm stem cells are and where the divisions occur to create sperm, and basically where those sperm start to mature. You can watch all about this in another video, which is about sperm maturation and production. So from there, what's going to happen is those sperm are going to go to the epididymis. This is like the storage place where they hang out, and then they're going to head through the vas deferens to start to get to that urethra. And now we're going to zoom in here. So we're kind of looking almost on the back of the bladder. Here's where the vas deferens is coming in, and next to that you've got seminal vesicles. So what the seminal vesicles do is they basically secrete like road snacks for those sperm. The sperm have quite a distance that they have to travel within the female reproductive tract. And basically what these guys are going to be doing is secreting sort of carbohydrate compounds and whatnot that the sperm can use for fuel while they're on their journey. So the seminal vesicle and the vas deferens come together in this ejaculatory duct, and this empties that fluid into the prostatic urethra. The prostate here has enzymes that it secretes, and these enzymes activate the sperm. So basically now they're active because of the prostate, and they have their road snacks for their really huge journey all the way up to the ovary that they get from those seminal vesicles. Then we've got these guys here. These are the bulbourethral glands, and the bulbourethral glands have an important role as well. They secrete a basic mucus, and the reason that this is important is that vaginal secretions are acidic, and since they're acidic, it's not the easiest environment for sperm to get through. Basically, it makes it so that only the best sperm get through, which guess what? That's you. So congratulations. Good job on that. And basically what these guys do is they make that mucus a little bit more basic. And by making it a little bit more basic, now they're going to help those sperm to survive longer. This is going to end up going through that, well, already we're looking at the spongy urethra. Remember, the membranous urethra is right here. Spongy goes through the penis, and it's going to come out the end of the penis, which is kind of disturbingly not present. I don't know what they were doing here, but that's a little scary. And if you're thinking, the urethra secretes both urine and sperm, you would be correct. It does. It's a little bit all-purpose in that way, so maybe the Swiss Army knife of men's organs. Okay, so let's do a little review of the path of sperm. So the sperm are going to start out developing within the seminiferous tubules. They're going to go from those seminiferous tubules to the epididymis. This is like sperm storage. From that epididymis, they're going to go through the vas deferens. And this, I guess, is the pathway to Jiggy Town from that vas deferens, now we're going to have other things come in. The seminal vesicle is going to be like, hey, I brought road snacks. All right, and these two, remember, are coming together in the ejaculatory duct. Okay, that ejaculatory duct is going to go through the prostate. And the prostate secretes enzymes that activate the sperm. So now they're swimming fast and they've got their road snacks, which is great. And then they are going to pass the bulbourethral glands. And these guys secrete a basic mucus. And that's not a sick burn, it just means the pH of the mucus is higher to kind of combat the acidity of the vagina. And then we're going to end up kind of in that spongy urethra. And we'll be on the way out. So that's sort of the path of sperm through all of that male tissue.